Welcome. This is the Pharmacy Services section of the training. For the Pharmacy Services Regulatory section, we have made small but significant changes to guidance at F755 Pharmacy Services, F757 Unnecessary Medications, and F758 Unnecessary Psychotropic Medications and PRN Use. There were no new Phase 3 regulations for these tags, but changes to guidance were made for clarification and in response to questions from nursing home stakeholders. Language was changed regarding disposal of used fentanyl patches and antibiotic stewardship requirements. For F758 guidance, new language has been added regarding other classes of medications not specifically listed in the psychotropic medication regulation. We also added language related to potential misdiagnosing of residents with a condition for which antipsychotics are an approved use, such as schizophrenia. The new diagnosis then excludes the resident from the long-stay antipsychotic quality measure. At F755, we revised the guidance on disposal of used fentanyl patches. We explain how the Food and Drug Administration instructions to fold the used patch and flush down the toilet are not always appropriate for nursing homes. We also explain that the Environmental Protection Agency does not currently ban flushing of pharmaceuticals unless they are hazardous. Fentanyl patches are not classified as hazardous. However, state and local laws may restrict flushing of pharmaceuticals. The guidance states that nursing homes may use drug disposal systems for fentanyl patches if they can show that the system minimizes accidental exposure and diversion. Lastly, this guidance states that disposal of fentanyl patches in common areas or resident room trash cans or sharps containers would not be compliant, as these methods do not prevent accidental exposure or diversion. In the key elements of noncompliance section of the guidance for F757 and F758, a note has been added. The note directs the survey team to consider whether a facility is compliant with F881, the tag for the Antibiotic Stewardship Program, if the team has found evidence of unnecessary antibiotic use. The unnecessary antibiotic use could indicate that a facility is not implementing part or all of an antibiotic stewardship program, which entails using protocols that utilize an infection assessment tool, monitoring of antibiotic use, or feedback and education to prescribing providers. The Phase 2 regulations and guidance released in November of 2017 expanded the category of antipsychotic medications to the new category of psychotropic medications. This regulation defines a psychotic medication as any drug that affects brain activities associated with mental processes and behavior. This new category includes medications in the categories of antipsychotics, antidepressants, anti-anxiety medications, and hypnotics. This change was made out of concern that use of psychotropic medications other than antipsychotics could increase as nursing homes attempt to decrease use of antipsychotic medications through efforts such as the National Partnership to Improve Dementia Care. The guidance also described other medications which affect brain activity. These medications may be clinically indicated, but can also have adverse consequences. New guidance explains that these other medications are subject to the psychotropic medication requirements if documented use appears to be a substitution for another psychotropic medication rather than for the approved or original indication. An example could be a seizure medication, which is being given to a resident with no history of seizures. However, the medical record shows the medication is prescribed and given to treat symptoms of agitation. In this case, the use of the seizure medication should be consistent with the psychotropic medication requirements under Section 483.45E. We also added language related to the gradual dose reduction guidance in F758. We added language to further describe gradual dose reductions, which states that dose reductions should occur in modest increments over adequate periods of time to minimize withdrawal symptoms and to monitor symptom recurrence. Resources were also added to provide information on gradual dose reductions. We added language to address situations CMS has identified where residents are potentially misdiagnosed with a condition for which antipsychotics are in approved use, such as a new diagnosis of schizophrenia. This diagnosis excludes the resident from the long-stay antipsychotic quality measure. When investigating a potential misdiagnosis, surveyors should consider Section 483.21B3I, F658 to determine if the practitioner's diagnosing practices meet professional standards, and Section 483.20G, F641, to determine if the facility completed an assessment which accurately reflects the resident's status. Language was also added to the guidance for F658 and F641 to align with the changes in F758. We added language to the section on investigating concerns and the side effects table, which directs surveyors to evaluate if a resident has experienced psychosocial harm related to the side effects of medications. Surveyors should look at whether side effects such as sedation, lethargy, agitation, mental status changes, or behavior changes affected the following: the resident's abilities to perform activities of daily living or to interact with others, cause the resident to withdraw or decline from usual social patterns, show the resident has decreased engagement in activities, and or has caused diminished ability to think or concentrate. Lastly, we updated the deficiency categorization section to ensure the examples show the appropriate severity level. Congratulations, you have successfully completed this section of the training. If you have questions about this training, please send them to the DNH triage mailbox at DNH_triage team@cms.hhs.gov. Thank you for your continued efforts toward our shared goal in providing quality care to America's nursing home residents.